Hi, and welcome to Ask the Doctor. I'm your host, Mike Berger. Here to answer your medical questions today are Dr. Robert Bolger and Dr. Renaud Rodrigue from the Southwest Pain Group. Southwest's mission is to care for patients who suffer from chronic and acute pain. The Southwest Pain Group is actively involved in the care of patients who suffer with pain issues. If you would like some questions answered, just call the number on your screen. It's 1-888-572-4411, or go to the website, www.southwestpaingroup.com/askthedoctor. Let's get started with a question. Dr. Renaud, how long has the Southwest Pain Group been in business? And maybe the most important question of all, what the heck is pain?
Well, we've been around a good long time. Dr. Bolger started the group over 20 years ago, and I came on board about 16 years ago. And Mike, to answer your question, it's a great question. Pain is a very unmeasurable phenomenon. It's like an emotion. Pain is a subjective thing. You can't really quantitate it, you can't prove it, you can't show it, you can't demonstrate it to anyone around you. You can look totally normal and have horrible pain. So that's kind of the conundrum. Patients suffer. Family members see them, you look pretty good to me, I don't really see anything wrong. You say you have pain, I see no manifestations of that, because there aren't any. Chronic pain is unmeasurable.
And you talked now we're talking about chronic pain, but there's also acute pain. So between the two, I would assume there could be a great cost.
Absolutely. The cost of pain to this country is easily in the billions of dollars. Tens of thousands of patients are hospitalized each year with pain or go to their doctor because of a pain complaint. And then there's a loss of work, productivity, interaction with your family, prolonged hospital stays because of untreated pain, ER visits. So it's in a time like this when things are soaring out of control as it is in the economy, this is just one more thing that needs to be addressed because of cost issues.
Very good. The phone lines are open, so let's get started. John from Plano is with us. John, what's your question?
I had lower back surgery 3 years ago and there's still pain. Can anything be done about it?
Dr. Bolger?
Well, John, actually, yes, there is many things that can be done about it. And the first thing that has to happen is we need to know why you still hurt. Because there's always a reason. There's always a reason. And one of the things we do in our specialty is we use diagnostic procedures and specialized kinds of treatments to actually locate the pain. It's called pain mapping. So we would probably have John come to our office, examine him, and start a mapping program to try to diagnose why he still hurts.
Now, most of your patients are outpatients, right?
That's correct.
Yeah.
We do see patients in the hospital, though, because we are often called upon to do pain mapping on patients in the hospital as well.
So what kind of, this may sound like a strange question, what kind of doctor are you? We're talking about pain, but are you a anesthesiologist? Are you a surgeon? Where did this all start?
Well, that's a good question. A lot of times patients don't know what a pain doctor is, but in fact we are anesthesiologists, and actually the specialty was born from anesthesia. Okay,
now Gary in Lancaster wants to know, what causes chronic pain?
I'll take that one on. Chronic pain is basically, the definition of chronic pain is pain that persists beyond normal healing time. So it varies on the injury. If you have a broken arm, you expect to hurt for a few weeks to a month or so, you should be better. Pain that persists with a broken arm after a month would be chronic pain. But chronic pain by definition is pain that's been going on for 3 to 6 months or longer. What causes chronic pain could be anything from a nerve injury, a surgery that went awry, or even a surgery that went well, but something happened to some nerves in your body, they were damaged, they're scarred, that leads to people having persistent pain. Okay. There's musculoskeletal entities that cause chronic pain, such as fibromyalgia, and a host of others.
Well, that kind of answers our next question, because Carolyn DeSoto wanted to know if joint pain is considered chronic pain or acute pain, or both.
Really, it can be both. Because you can have flare-ups of acute pain from such as gout, arthritis, but it often can damage the joint and can become a chronic condition.
And we're going to take a slight break. We'll be right back. Don't forget, you can call us at 1-888-572-4411. You're watching Ask the Doctors. And welcome back to Ask the Doctor. I'm your host, Mike Berger. Here to answer your medical questions on pain management today are Doctors Robert Bolger and Renaud Rodrigue from the Southwest Pain Group. You can just call the number that you see on your screen. That's 1-888-572-4411. Or you can visit the website at www.southwestpainmanagement.com/askthedoctor. All right, let's get started with a question. What are the advantages of the Southwest Pain Group's in-office treatments versus going to a hospital for treatment?
Well, there's many ways you can receive pain treatment. The diagnostic and technical procedures we do, but there's some advantages for coming to our office because we can actually lower the cost. We can perform the procedures more economically, a lower copay to the patient. And we have the same facilities in our office as they're in hospitals.
Right. What I would imagine, you mentioned copay, and that's very important to people these days, that you do take most insurances, I would assume.
Yes.
Okay. Now, Stacy's with us from Dallas, and she's on the line. Stacy, what's your question today?
I've had chronic pain for over 5 years now, and I'm only 20. I've had so many people tell me that the pain is all in my head that I'm beginning to wonder, could it be me just imagining it?
I think that's such a great question because we've all known someone who said, people tell me it's just in my mind.
I wouldn't mind taking that one on because that's a kind of a topic near and dear to my heart. I have a lot of patients that are very young, and invariably, just like Stacy, they will come to us and say, no one believes me. And you look at young people, you think they can't have pain. People kind of discount pain in the younger population. Well, how can you be in chronic pain? She started at age 15, and in all likelihood has real pain. The problem is we're told we can't see it, we can't measure it, your studies look normal, you don't have it. When again, you got to get back to the point that pain is virtually unmeasurable. Now the things you can see with studies, a broken arm, a broken rib, you can see that, a torn muscle, you can measure that, you can MRI that. Some people have pain that's unmeasurable. Headache pain is an example of that. How do you measure a headache? People tell you they have a headache. So you can't, first of all, you got to believe the patient. You got to take them seriously. You got to give them a chance to tell you their story. And really, Mike, in my experience now 16 years doing this, I find it extremely unusual that patients are making it up or that's in their head.
What I find interesting is when people talk about pain, sometimes it's very hard to relate to a doctor what I'm feeling. How do you guys deal with that?
Well, let me say that to you if you don't mind,
Sure.
Bob, because I want to tell you that's, and I'm hogging the show a little bit here, but I'll tell you, pain's hard to measure and it's hard to describe too.
Yeah.
That's the real conundrum. It's how do you describe to your doctor the pain, and you'll find that patients use different words to describe their pain entity, and we use that. It's helpful, but a lot of it's too just the progression, how it changed over time, how its onset. We can work with people and figure that out.
Very good. Another caller, Tammy is with us. Tammy's from Frisco. What do you have for the doctors today, Tammy?
I hurt my neck about a year ago, and I've been on pain pills ever since, and I'm afraid of becoming addicted to them. Should I just stop using them right now?
Well, I think an important thing for Tammy is that she does need a diagnosis. And so having a diagnosis is critical because once you have a diagnosis, there are ways to impact that pain, treat it, perhaps come up with a solution that won't involve medications. So the answer is yes, we can help people wean off their medications. And we do that as an outpatient all the time.
And there are people who actually do need to be on pain medications chronically. And there's nothing wrong with that as long as you're monitored by someone who understands the drugs, their side effects, the problems of tolerance, etc. So she doesn't necessarily have to come off her drugs. It just depends on what's going on.
Well, a question I have and it happens so often now, especially with insurances, that I'll go to my physician, primary physician. He'll tell me, I'll say, Doc, I have this pain, so on and so forth. He'll give me something for it. I'll go home, and that's the end of the story. But the pain doesn't go away. Now, can I ask him to refer me to you, or can I just call you?
We take referrals two ways, and originally, pain management doctors were typically referred by other specialists. But we actually see patients directly, and that is an important thing for people to understand, that we actually can coordinate their pain care. We will try to find the cause and try to manage that element of their care.
Very good. Keith from Garland. Keith wants to know if his pain management will be covered by insurance, and we've been talking about that a little bit.
Typically it is. Most of the time, most insurance companies will cover pain treatments. There are some unusual or I would say avant-garde or cutting-edge treatments where there can be some difficulty at times getting them covered. But we will often go to bat for the patient. We will try to contact the insurance company, and we will make a compelling case for the treatment if we feel it's ethical.
Definitely. It's rare that patients can't come to us and seek treatment, even chronically, because of payment issues. That's rarely the case.
I'm kind of curious to know if there's how should I put this, a wow factor in pain management, something maybe people don't know or don't understand.
Well, I think for me, one of the biggest things for people to know about pain management is that you have to make sure you pick the right person. There's a wide variety of doctors treating pain, and so not all pain management doctors are the same.
Is there a way to judge that then? If obviously I like you fellas, so I would call you, but what about anyone else that's just watching the show today?
If I were to recommend one thing to patients, I would say do your homework. You want your doctor to be fellowship trained. A fellowship is a specialized training. It's an elite training it's only awarded to a certain group of doctors. So if your doctor's fellowship trained, anesthesiologist, obviously, because anesthesiologists are the most skilled doctors at nerve blocks. That's what we do every day. So if you've got a fellowship trained doctor in anesthesiology, you're probably board certified. You have a pretty good chance you're going to get a good doctor.
Get somebody who knows what they're doing.
Right.
And that's always important. Scott in Mesquite would like to ask if there's a difference between acute and chronic pain. And we touched on this a little bit, but again, what would the biggest difference be?
I think Dr. Rodriguez spoke to this earlier. I think that the strict definition of chronic pain is pain you've had for more than 6 months. But from our perspective, it really ends up being patients that come to us who other people feel like they can't help. They'll tell us every day you hear this, well, my surgeon said I'm better, my back healed, or my fracture healed, or they don't know what's wrong with me, but I'm still hurt, and they don't know what to do. That's really ends up being what we view chronic pain as. I can't be helped anymore, what can you do for me? And that ends up being, you agree?
Absolutely.
And what kind of success can people have? Because everybody's different, different problems. If I had a chronic pain, can I expect or hope to expect 50% improvement, 75% improvement? Is there a particular?
That'd be hard to answer.
Yeah.
because it would really depend on the disease and what the problem is. For example, with headaches, we can make real big inroads in headaches. There's exciting new therapies in headache. But if you've had a chronic pain for 15 years in your back or your foot, we might have a hard time giving you an exact percentage.
But we could definitely make an impact. It's rare that we
help
can help
everybody,
people.
Mike, to some
and
degree.
then it's just a matter of degree.
Right.
But we really do look at it as a disease by itself. It's like having diabetes. It doesn't really go away a lot of the time. So we manage it like a disease over the long haul.
And that's very important to remember, that it is a management.
Right.
We're going to take a short break. Again, if you would like to call us with your questions, the number is 1-888-572-4411, or you can go to the website. That's www.southwestpaingroup.com/askthedoctor. We'll be right back. And once again, welcome back to Ask the Doctor. I'm Mike Berger, here to answer your medical questions on pain management today. Dr. Robert Bolger and Dr. Renaud Rodrigue from the Southwest Pain Group. Just call the number that you see on the screen. That's 1-888-572-4411. Or visit the website at www.southwestpainmanagement.com/askthedoctor. Okay, so far we've talked about pain management. We've had a lot of questions, a lot of very good questions. Renaud, I'm kind of curious if there is a case maybe that you did last week or last month that's been very interesting to you, very unique.
I've had a few really great ones recently, some really complex cases. One of the ones that kind of stuck with me last week was a very lovely young lady who came in now about 5 months after a motor vehicle accident. And her original injury was neck pain. She had a really severe collision, was forcibly pushed back in her seat, and had more of a hyperextension injury. That got better, but her back was bothering her too. So I found her to be incredibly good historian. She gave me a good description of what was going on with her. And the reason why this is germane to our top conversation today is that this is a classic person who would normally just kind of wallow out there. We're talking about 5 months after an accident. Her internal medicine doctor, well-intentioned though he is kind of sat on it because he didn't know what else to do with her. She's a young lady. She looks good. The x-rays look good. The MRI look good. Figures, well, it'll eventually go away. But we're talking about 5 months now. And meanwhile, she's suspended running, all exercise, in fact, and is starting to get depressed. And I found her to be just the ideal patient for us because there's a lot we can do for this young lady.
How about you, Robert? Any particular case?
Well, a case last week, which is interesting for me because they're ones that we can profoundly help. And these are people with migraine attacks. Typically, a patient with migraine would go to the emergency room or would take some migraine medications, but we're actually treating these people in our office. So this gal came to our office, and we do a kind of last minute. She called last minute, we got her in, we started an IV, and we give them some kind of acute headache breaking medications that can break the migraines in the office.
So many people have migraines. I had a nephew that they were so bad that he would vomit and become very, very sick. A, are there more migraines, and B, are there new medications like you were just talking about that are actually helping?
Well, interestingly enough, the most exciting thing right now for me in pain management is this new migraine therapy. It's called the Reed procedure. It was invented by a doctor here in town, Dr. Reed, and it's revolutionizing migraine therapy.
Fantastic. People call if you have a migraine problem, and the doctors will certainly be able to help you or refer you to someone that can do as much as can possibly be done. Going on with a call now from Fort Worth. What's your question, Art?
I've been on Demerol for chronic pain and need to take a drug test for a new job. Can I be discriminated against for my drug use?
That is a great question.
It is a good question, and it's a delicate issue. But if a patient ethically needs medication for their pain condition, then they have the drug test, then the physician that's prescribing that medication can provide that patient with written support that they need that for medical reasons. So there are medical reasons why people need medication, and we do prescribe and we do support those patients.
Very good. Now, if you'd like to know about other pains, of course, we want to remind you once again to call the phone number on your screen. That's 1-888-572-4411, or go to the website. Something else that I've run into recently, because it happened to a friend of mine, is pain and chronic pain because of cancer or cancer treatment.
Right.
What can we do there?
That's a great area for us because there's just so many things we can do. For instance, we have found that a lot of doctors are so focused, the oncologists are so focused on treating the cancer, pain becomes kind of an afterthought. And even though these doctors are skilled at treating pain, they often are more worried about the cancer treatment itself. So we can impact those people with simply giving them better pain meds, not just that, but also blocks and injections that can help the pain, or even kill nerves that are causing the pain, which is an option that you don't have really for the non-cancer patient population. We can be more aggressive with those people and still be safe to really help alleviate their pain.
A question that I would have, I know we all know people that have had back problems, one reason or another. Are there different parts of the body where pain is much more difficult to manage or to diagnose? Is it a back? Is it a neck?
I don't think there's a particular area that's more difficult. I think the nature of the injury can create difficulty. If it's a nerve injury, that tends to be more difficult to treat than if it's just a tissue injury. So would you not agree that nerve-related pains are more difficult?
Up to one point, which is some of the patients who have pelvic pain. Pelvic pain is very difficult to treat. We don't see a lot of it. We do have techniques. For me, in my practice, that's been one of the most difficult things to treat. Otherwise, Dr. Bulger's right. Everything else, there are options.
We can always help, but pelvic pain is challenging.
Yeah.
All right, if you would like to ask a question of our doctors today, feel free to call the number on your screen. That's 1-888-572-4411, or go to the website. That's www.southwestpaingroup.com/ask-the-doctors. We'll be right back. And welcome back. I'm Mike Berger, your host today for this Ask the Doctor program. And what we would like to do is get right to a question, my question for these gentlemen. What can a pain management doctor do that other doctors can't or maybe aren't as qualified as you are?
Well, first of all, Mike, you know we're anesthesiologists.
Right.
So all anesthesiologists are focused during our training on putting people to sleep safely, waking them up safely. But in addition, we're also experts at nerve block therapy. And fellowship-trained doctors like us can perform discrete, specific kinds of spinal nerve blocks, very, very specific blocks on special nerves throughout the spine. In addition, we do procedures that involve neurostimulation, such as spinal stimulators. You want to talk about those for a second?
That's a really elegant technique, Mike, whereby we can put electrodes in patients and test the area of the pain, try to map it so we cover the area of pain, and if it's successful and the patient really likes the way it feels, you can implant it. It's like a pacemaker for pain. It's a very non-invasive procedure. The patient goes home the same day.
I admire you guys so much because it's almost like this, the body is a giant jigsaw puzzle, and you just kind of work with different pieces, and pretty soon it starts to fall in place.
Very much so. It's really fun. It's really fun to take someone who's suffering and have them say, you really made a difference in my life.
Sounds good. We have a question from Ricky, who is calling from Azle. Ricky?
I'm not a believer in drugs, and I'm wondering what the benefits might be of alternative therapies like yoga or acupuncture to treat my chronic pain syndrome.
Well, I'll take that one on because that's an interest of mine. There are actually many ways to treat pain, and I agree with him that you don't need to necessarily take powerful painkillers to get relief. There's a lot of alternative therapies, nutritional therapies, functional activities, ways to restore function. Sometimes medications can be helpful, but they aren't the whole answer.
Right.
So you gentlemen really look at this from a multi-pronged attack to what can we do to help this patient?
And really it's integration. We try to integrate their activities, their lifestyle, medications if necessary, and if ethical, we will provide them with long-term medications.
Now, we've talked about a lot of things today. We've covered a tremendous amount of ground. Is there anything that you would like to talk about that maybe we haven't touched on?
I think only just the fact that it's very important when a patient's seeking a pain doctor that they make sure that it's someone that's done a fellowship and is board certified. That's very important because there actually are different kinds of boards, and it's very important that you do your homework.
I've had a fabulous time today. I've learned so much, and I hope our audience has as well, because you guys come across wonderfully, and I'm sure you do fantastic work.
Thank you.
So I would like to thank Drs. Robert Bolger and Dr. Renaud Rodrigue from the Southwest Pain Group for joining us today. And remember, even though the show's over, your phone calls will still be answered. All you have to do is call 1-888-572-4411. And you can also visit the website at www.southwestpaingroup.com/askthedoctor. I'm Mike Berger. We'll see you next time.
This program is sponsored by Southwest Pain Group and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.